Hi, I'm Garrett Nagel. I will be presenting the communication issues doctors/nurses have with patients. I want my audience to know the importance of good communication and how to use good communication in hospitals when it comes to doctors/nurses talking to patients, and vice versa. Have you ever been to a hospital and listened to the doctor speak to you and get confused and frustrated? Well, you're not the only one. In fact, this happens daily. For example, if you broke your arm and went to the hospital to get it fixed, they might prescribe you a medication. You have no idea what this medication is, and the doctor doesn't tell you how many to take. You're about to ask how many to take, but the doctor has to rush into another room to help another patient. This is a big problem that doctors have and has happened to me when I broke my ankle. Going on, I want to inform you on how to stay calm under these circumstances, the effects of poor communication, and techniques doctors/nurses can use while dealing with patients. How to stay calm when a doctor isn't communicating with you properly. When you're stuck in this position, the first thing to do is stay calm. You don't want your emotions taken over, as it will end badly for you, and you won't get the answers you need. Take a second to process the information the doctor is saying to you, and then you can ask questions that will help you. Once you are calm, ask the doctor what something means. For example, if you're unsure what effects a medicine has on you, then calmly ask the doctor. Or if a doctor says you have a condition called cirrhosis, take a second to stay calm and process the information. Then calmly ask what that means and how it's going to be treated. Trust me, the last thing you want to do when communicating with the doctor is to freak him out. They're trying to help you, and you have to respect that, so show some courtesy when communicating with the doctor. And if you're still having issues with staying calm, let the doctor know that you need a second to process the information. They will understand and give you your space. Make a phone call, clear your head, or ask for some water. These will be beneficial in keeping a healthy communication between the doctors. According to Ken Smith, author of Effects of Poor Communication in Healthcare, he states that inefficient communication between a patient's physicians can result in subpar quality of care and poor outcomes for the patient. They are even, according to a study, one of the leading causes of preventable deaths in hospital. Now that we know how to stay calm when dealing with doctors, it is important to know the effects of poor communication in hospitals. When it comes to patients freaking out and them not using their head, it can cause a dangerous environment at hospitals. Screaming patients and even doctors can cause panic to other patients there, making it seem like an unsafe environment. This can also lead to patients or doctors passing out from stress or even have a stroke. Good communication is vital in hospitals, not just with patients, but with other doctors. A doctor might tell a nurse to give the patient a shot without looking at allergens, leading to the patient having an allergic reaction. Although this isn't common and still happens. Another factor of poor communication is if the doctor prescribes you the wrong medication. This could lead to patients not going to your hospital anymore, which is never a good thing. Since medication is getting more expensive by the day, the patient isn't going to want to pay for medication that they don't need, especially if it's expensive. Poor communication isn't only from doctors, but by patients too. Going back to the allergies, if the patient tells the doctor the wrong information, then it can be extremely dangerous. This can lead to allergic reactions, anaphylaxis, rashes, hives, or fever. So before you tell the doctor wrong information, just know it can be deadly. Now that we know the effects of poor communication, let's talk about techniques doctor can use while dealing with troubled patients. As we know, communication is one of the most important things when dealing with patients, but there are more useful things to know. Being a good listener is always important when dealing with an angry patient. Let them blow off their steam, but also keep the situation under control. If you see a patient being aggressive, diffuse the situation in a quick but diligent manner. Jennifer Fong Ha and Nancy Longenecker, authors of Doctor-Patient Communication, find it really important to train for these techniques. Communication skill training has been found to improve doctor/patient communication. However, the improved behaviors may lapse over time. It is therefore important to practice new skills with regular feedback on the acquired behavior. Make sure that you make the patient feel relatable. For example, if a patient thinks he or she is being crazy for doing a certain action, let them know that it's okay. If they look like they need validation, share a personal experience that you've had. Do whatever it takes to diffuse their anger. Remember, they want to go home safe and healthy. Make them feel comfortable and safe while you're dealing with them. Understand that being a patient isn't easy. Put yourself in their shoes and relate with them. The last place they want to be is in a hospital. Rather, that's because of themselves or a loved one. Just know that if you're having a bad day, imagine the pain they could be in. For example, if your patient dies from cancer and his mother is yelling at you, understand the pain and hurt they're feeling before you decide to backtalk them or say rude comments. It's not easy being in this field. You will experience pain, trauma, and much more. After considering all the information previously stated, I hope I helped you understand how important it is to have clear communication with patients and vice versa. We have reviewed how patients need to stay calm in stressful situations, the effects of poor communication in hospitals, and techniques that can help doctors/nurses help with stressed out patients. In the future, assuming I'm a doctor, I'll make sure not to forget how important communication is and will always put my patient first. Thank you.